Research has shown that the most effective kind of therapy for kids with obsessive compulsive disorder is cognitive behavioral therapy, or CBT, in which kids learn skills to overcome their worries. For the majority of cases, CBT usually takes 12 to 15 sessions to get substantial results, and if a child is seeing a clinician for the traditional once a week 1-hour sessions, that means 3 or 4 months. In other cases, the child's anxiety may be too acute or severely impairing your child's functioning, so waiting those 12 to 15 sessions is not tenable for families. In cases like these, we offer a more robust treatment option in the form of an OCD intensive. In our intensive OCD program, kids are seen 3 hours a day, 5 days a week, working one-on-one with a clinician using CBT with an emphasis on exposure and response prevention. And I provide one parent session each week the child's in the program. It involves exposing a kid to what makes them anxious a little bit at a time until they get more comfortable with the feeling. Response prevention means that the child is not allowed to do the ritualistic behaviors they've developed to make them feel better. Learning to deal with the anxious thoughts without doing OCD rituals makes the anxiety less powerful over time. Parents learn to stop taking part in their child's OCD rituals and support kids in using their skills instead. Unlike some other intensive programs, our program is highly specialized and tailored to the specific needs of your child. Every session your child is with us is with a dedicated OCD clinician for the one-on-one treatment. Intensive treatment also has advantages for kids whose anxiety is more moderate, but who've been resistant to treatment. And it's especially useful for families who live in parts of the country without access to clinicians trained in CBT and who can travel for treatment. Faster results. The advantages of intensive treatment are obvious for children who are severely impaired, whose anxiety or OCD has taken over their lives and the lives of other family members. Often these kids are not able to go to school, participate in normal activities, or see friends. Sometimes they can barely leave their rooms. Intensive treatment means getting kids released from their suffering in a matter of weeks rather than months. It's very exciting that you can get a whole course of treatment in a relatively short period of time, and kids can get back in control of their lives and able to go back to school and do the things they care about. Here's how it works. Anxiety thrives when children avoid things that make them anxious or develop rituals to cope with their fears, like washing their hands or touching things in a certain order. Over time, these accommodations allow the anxiety to grow, and the avoidance and rituals become more and more time-consuming. In treatment, kids learn how anxiety works, how avoiding it gives it more power, and they develop skills to tolerate it without escaping or performing the rituals, and they learn to overcome their struggles. The clinician will help kids confront fears in a controlled, incremental step. At each step, with repetition and practice, they see their anxiety subside and are ready to work their way up to bigger fears. Accelerated learning. If you think about it like learning a language, it's similar to taking a 2-hour class every single day with homework in between. You're exposed to it over and over, burning it into your memory through lots of experience and lots of practice. However, if you only went to class but didn't do the homework, you would learn the language more slowly and not have as strong of a grasp of the language. In CBT, kids practice not only during sessions but in between them as well, and evidence shows that the most amount of change occurs as people apply the skills they've learned to an array of multiple settings. When sessions are weekly, there is a lot of distraction between sessions and competition for kids' and parents' attention, so homework may not be as consistent. When the family is focusing on the treatment intensively, they're more likely to do the homework consistently, and learning is accelerated. Kids start to see the results quickly, which increases their commitment to the treatment and motivates them to work harder. Treatment for OCD works best with high compliance and high motivation. When we do intensive treatment, kids learn the skills faster and get results faster. They get more empowered and motivated because they see it works, when earlier treatment hasn't worked. Intensive treatment is particularly helpful for children who've made little to no progress in the treatment they've been given thus far, whether it's traditional talk therapy or even with a general CBT clinician. One reason treatment might not be working is your child might not be getting the full version of the CBT or getting a watered-down version. In graduate school, psychologists may study treatment techniques such as psychodynamics, CBT, Gestalt, and then use a combination in their practice that incorporates some CBT but doesn't follow through enough to be effective. Another obstacle may be that a clinician has CBT training but no experience or application to a particular condition. Having a specialty in CBT for eating disorders or insomnia doesn't automatically make someone an expert in OCD. A common problem is that a clinician may focus on one particular trigger for anxiety and miss others. For example, a child who's afraid of contamination and avoids touching the floor, which he fears might make him sick. The child might successfully do exposures that involve touching the floor and picking up things from the floor, but the anxiety about getting sick could remain. This child will show some improvement, but will still have a fair amount of powerlessness about the thoughts and will get caught up in the symptoms again. The last reason that treatment might not have worked in the past is that parents and families aren't always included in the treatment process. A drop off your kid, pick up your kid process isn't going to be as successful as when parents are involved as what we call co-therapists. So let's talk about parents' role. Research shows that reducing family accommodation of children's anxiety makes treatment more effective. Parents often try, understandably, to make the home and family life safe for a child by giving them repeated reassurance or banishing things that trigger anxiety. They're trying to protect the child, but by doing so, reinforce the child's unhealthy coping strategies. They're actually feeding the anxiety. Essentially, by intending to help, parents inadvertently become the child's bad coping skill. It would be understandable for someone to hear about exposures and think, there's no way my child could handle that. However, it's really more about slowly and systematically facing the things that prompt anxiety and learning how to overcome the anxiety so they're not to be feared or avoided moving forward. And it's really rewarding to watch your child fight the symptoms and become empowered to fight more. Thanks for joining me in this video. I'm Dr. Jerry Bubrick, a child psychologist and director of the Intensive Pediatric OCD program at the Child Mind Institute. To learn more about OCD and related disorders, visit childmind.org/OCD support. There you'll find everything you need to know about OCD treatments at the Child Mind Institute, plus hundreds of articles and guides to help you support children who are struggling with mental health, behavior, or learning challenges.